Welcome to our channel. Today, we're going to talk about a revolutionary diabetes treatment called Ozempic. It's a medication that's been making waves in the medical community due to its ability to help lower blood sugar levels in people with type 2 diabetes. The active ingredient in Ozempic is semaglutide, which is a glucagon-like peptide-1 receptor agonist, GLP-1 GLP-1 are a type of medication that work by mimicking the effects of a naturally occurring hormone called GLP-1. This hormone helps regulate blood sugar levels by stimulating insulin release and reducing the amount of glucose that's produced in the liver. Ozempic is administered once a week via subcutaneous injection, and studies have shown that it can significantly reduce HbA1c levels, a measure of average blood sugar levels over the past 2 to 3 months, compared to other medications. In fact, a study published in The Lancet Diabetes and Endocrinology found that people with type 2 diabetes who took Ozempic saw a greater reduction in HbA1c levels than those who took another GLP-1 called dulaglutide. So, if you or someone you know is living with type 2 diabetes and struggling to manage their blood sugar levels, it may be worth talking to your doctor about Ozempic. Now that we've talked about how Ozempic works in the body, let's take a look at some of the benefits of this revolutionary diabetes treatment. Ozempic has been shown to not only lower blood sugar levels but also to aid in weight loss. This is because the drug works by mimicking the effects of a hormone called glucagon-like peptide-1, GLP-1, which is responsible for regulating both blood sugar and appetite. By mimicking GLP-1, Ozempic can help people with type 2 diabetes lose weight without feeling hungry all the time. In fact, studies have shown that people who took Ozempic lost an average of 12 to 14 pounds over the course of a year. Additionally, Ozempic has been shown to reduce the risk of cardiovascular events, such as heart attack and stroke. This is important for people with diabetes, who are at a higher risk of these types of events. So not only does Ozempic help regulate blood sugar levels, but it can also help with weight loss and reduce the risk of cardiovascular events. These benefits make Ozempic a truly revolutionary diabetes treatment. As I mentioned earlier, Ozempic is a once-weekly injection that helps lower blood sugar levels in people with type 2 diabetes. But how exactly does it work? Well, Ozempic belongs to a class of drugs called GLP-1 receptor agonists. GLP-1 is a hormone that is naturally produced by the body after we eat. It stimulates the release of insulin from the pancreas, which helps regulate blood sugar levels. GLP-1 also signals to the liver to stop producing excess glucose and reduces appetite, which can lead to weight loss. However, in people with type 2 diabetes, the GLP-1 response is often impaired, which can lead to high blood sugar levels. Ozempic works by mimicking the action of GLP-1 in the body, helping to stimulate insulin release, reduce glucose production in the liver, and decrease appetite. This leads to lower blood sugar levels and can also help with weight loss. It's important to note that Ozempic is not a cure for diabetes and should be used in conjunction with other diabetes medications, as prescribed by your healthcare provider. And as with any medication, it's important to discuss the potential benefits and risks with your doctor before starting treatment. Now, you may be wondering how Ozempic compares to other diabetes medications. Ozempic belongs to a class of drugs called GLP-1 receptor agonists. This class of drugs works by mimicking the action of GLP-1, a hormone that is produced in the gut. GLP-1 helps regulate blood sugar levels by stimulating the release of insulin from the pancreas and slowing down the rate at which the liver produces glucose. Other GLP-1 receptor agonists that you may have heard of include Byetta, Trulicity, and Victoza. However, Ozempic is unique because it has a longer half-life than these other medications, which means it stays in your system for a longer period of time. This allows for once-weekly dosing, rather than daily or twice-daily dosing like some other medications. Additionally, studies have shown that Ozempic can lead to greater weight loss than some other GLP-1 receptor agonists. In a clinical trial, patients who took Ozempic lost an average of 5.5 pounds more than patients who took Victoza, another GLP-1 receptor agonist. So, not only is Ozempic effective at managing blood sugar levels, but it also has the added benefit of potentially aiding in weight loss. It's important to note that individual results may vary, and it's always best to speak with your doctor to determine which medication is right for you. So far, we've discussed how Ozempic works and its potential benefits. But, as with any medication, there are some potential side effects to be aware of. The most common side effects of Ozempic include nausea, vomiting, and diarrhea. These symptoms usually go away on their own within a few days or weeks. However, if they persist or become severe, it's important to speak with your healthcare provider. Less common side effects of Ozempic include pancreatitis, gallbladder disease, and kidney problems. If you experience severe stomach pain or vomiting, yellowing of the skin or eyes, or dark urine, contact your healthcare provider immediately. It's also important to note that Ozempic may not be suitable for everyone. If you have a history of pancreatitis or thyroid cancer, for example, your healthcare provider may recommend a different treatment option. Overall, Ozempic has the potential to be a game-changing medication for people with type 2 diabetes. But, as with any medication, it's important to weigh the potential benefits against the potential risks and to speak with your healthcare provider about whether it's right for you. If you found this video informative, please subscribe to our channel for more educational content on health and wellness. Don't forget to hit the like button and share with your friends and family who may find this information useful. Thanks for watching.